Hello, my name is Ernie Schloss. I've been working as a strategic planner for almost 40 years now in a variety of settings in both government and the private sector. This has included being involved in community planning, hospitals, long-term care facilities, behavioral health, virtually every setting in healthcare. In more recent years, I've also been teaching public health to students at the Mel and Enid Zuckerman College of Public Health at the University of Arizona. So what I hope to do is combine my practical experience with my academic study and give you an introduction to the topic of strategic planning.
Let's review the basic objectives for this module. The first is to define planning, strategy, and strategic planning itself. Then we'll talk a little bit about why you would want to do strategic planning and what some of its benefits are. We will finish up the first objective with a quick overview of simple, complicated, and complex situations in which strategic planning might occur. Second, we will describe two processes that are fairly typical of those outlined by many strategic planning experts. The first is John Bryson's 10-step model, and the second is Richard Lynch's prescriptive model. Finally, we'll look at two Arizona examples of public health strategic plans that are posted on the internet. Let's begin with a discussion of planning, strategy, and put them together in strategic planning. In all my years that I've been doing strategic planning, I've come to the conclusion that a major, often unstated goal of planning is to reduce uncertainty about the future through people and their organizations developing shared agreements about how they will engage the future. Of course, none of us can really know what will happen tomorrow, next week, let alone 5 or 10 years from now. But there are tools, techniques, and ways of thinking that can lead to a greater understanding of what the future might look like. And, as we shall see, the mere act of coming to agreement about what the future might hold and how we will face it together can be a powerful force in an organization or a community. It's also important to recognize that planning is about change. Also, we rarely plan to do more of the same. Either we're trying to improve something that we're already doing, stop doing something that no longer serves us or our key stakeholders or constituents, or doing something new and different. Because everything is constantly changing, the context in which we exist will force us to change. Strategic planning involves being thoughtful and deliberate about how we change. It allows us to be more proactive and less reactive to the world around us. People will often make the statement that it's human nature not to want to change. However, in fact, we are changing constantly. Without going into any details of change theory here, suffice it to say that if we engage people in planning the changes that will affect them, they will be more likely to embrace those changes. It's important, I believe, to distinguish between the planning process that people use to come to agreement about how they and their organizations or communities will face the future and the plans that they produce as a result. I have witnessed and participated in planning processes that lasted more than 2 years, and I've seen planning processes that produce results in as little as an hour. Likewise, I have seen the actual planning documents that resulted from planning processes that were 100 pages or more, with hundreds more pages of technical appendices, and have seen plans, and we'll show you an example, that are on one sheet of paper. I have even heard of plans that were never even committed to paper, but were a verbal agreement sealed with a handshake. The point is, and I will stress this throughout this module, there is no correct way of conducting planning or even writing a plan. There are only preferred ways, and sometimes some methods may be more effective than others. Let's talk briefly about planning processes, although an in-depth discussion is beyond the scope of this introductory model. I believe that there are some underlying foundations that are essential for effective planning. I think they build on each other, much as I have illustrated on this slide. As planning is decidedly a human activity, the first building block is a grounding in intrapersonal, interpersonal, and cultural dynamics. What do I mean? By intrapersonal, I mean all the thoughts, beliefs, feelings, emotions, motivations, and attitudes that we carry around in our individual heads. We are constantly interpreting the world around us based on an inner story we invent about the world. By interpersonal, I mean the way in which we interact with others in groups, and by culture, I mean all the rules for living that we collectively share in groups. While an in-depth discussion of these is beyond the scope of this module, suffice it to say that all of this is below the surface, as indicated in this picture of an iceberg. The second foundation, shown in blue in the slide, is what is known about facilitating group learning and decision-making to help people reach shared agreements about how they will face the future, as I mentioned earlier. Finally, we need well-grounded theories and frameworks specific to planning to help us collectively create the future we desire for our organizations and our communities. Collectively, these foundations in individual and group behavior, how to facilitate collective learning and decision-making, and how and why to conduct planning are all needed for effective strategic planning. In this module, we will spend the rest of the time talking about planning theory and methodologies that most people use most of the time. So what is planning anyway? In 1973, during my second day on the job as a novice planner in Cochise County, Arizona, an older and much wiser planner, meaning he was 2 years older than me and he'd been a planner for a year, told me that all planning boiled down to 3 essential questions. Where are we now? Where do we want to go? And how do we get there? These 3 questions have become a touchstone for me over the years. When the situation becomes confusing and I'm not sure where I'm headed, I come back to these 3 simple questions. Later, I added, how did we do, or evaluation, to complete the cycle. Just to show you I'm not alone, the diagram on this slide comes from the World Health Organization, and it shows a slightly expanded version of the diagram I just showed you. Next, let's define strategy. The term, as you can see in this dictionary definition, comes from Roman military history. This definition contrasts strategy, as having a large operational scope, with tactics, which traditionally have been more concerned with the immediate issues on the battlefield, or in our modern circumstances, an organization, program, or a community itself. In some ways, this is the distinction that people sometimes make between strategic planning and program planning. Strategic planning has a number of key attributes. It is systematic, a deliberate process that sets the direction and scope of an organization over the long term, and it builds agreement and commitment among key stakeholders. Strategic planning produces both decisions and actions, while it shapes and guides the organization in deciding what it is, what it does, why it does it, and importantly, who it serves and how it serves them. Finally, it is useful in establishing priorities for the organization. According to the literature on the subject, there are clear benefits of strategic planning. I believe the first listed on this slide is probably the most important. That is, strategic planning, I believe, can expand the way people think about their organization in its current environment and how all that may change in the future. Other benefits include improved decision-making, enhanced organizational effectiveness, and even broader societal effectiveness. Other studies have found that the people who are involved benefit as well. Finally, strategic planning has been found to enhance the performance of large and small organizations in profit, not-for-profit, and governmental settings. Next, I want to discuss a question that keeps arising as I both do strategic planning and teach about it. That is to say, how does strategic planning differ from other forms of planning, especially what is called program planning? My simple answer is that there is what I would describe as a planning continuum, with strategic planning on one end and project and/or business planning on the other. In terms of scope, strategic planning tends to deal with the big picture over a longer time frame and with greater concern for trends in the external environment. At the other end of the continuum, the planning process and the plans are much more focused, the time frame is shorter, and the plans are more internally focused on the needs of the project. In reality, what I often find is that there is a nested hierarchy of planning, with a broad strategic plan that frames the entire organization, and subsequent program or project plans that focus on the implementation of the strategic plan in organizational subunits or that are focused on specific issues. For example, a health department or a hospital may have a broad strategic plan dealing with the entire mission of the organization, but then also have specific, more detailed plans focusing on diabetes or maternal and child health as examples. People also often ask me about budgeting and its relationship to strategic planning as well. What I tend to see is that while many organizations make certain that their annual operating and capital budgets are consonant with the strategic plan, detailed budget and resource issues generally are detailed at the program or project or business level. I'd like to offer a couple of caveats and rules of thumb based on my vantage point of having practiced and taught about this topic now for most of my career. First, it is extremely important to recognize that while many people have their favorite definitions and strategic planning processes, there is no right way to do this. Henry Mintzberg, a distinguished management professor at McGill University, has identified 10 distinct schools of strategic planning, and there are probably several more. What I have found is that consultants and other practitioners of strategic planning tend to push their favorite methodology. I have been a member of and have worked extensively with strategic planning consulting firms that had their own methodologies, sometimes evidence-based, sometimes merely based on the practitioner's own preferences and experience. Oftentimes I have heard someone say, "Oh, that's not strategic planning," when in fact strategic planning, as we will see, covers a number of different philosophies, methodologies, and end products. Remember, in the end, strategic planning still comes back to those fundamental questions I raised earlier. Where are we now? Where do we want to go? And how do we get there? The next important point is that there are no correct format or contents of a strategic plan, only preferred ways. Now, if there's a format preferred by your boss or your governing body, then by all means that should be your preferred way too, unless you're in a position to suggest something different. If the process produces a satisfactory, agreed upon strategic plan, then how it's written, as long as it's understandable to the people who need to follow it, is less important. I've seen strategic plans copied on a couple of pages and 4-color glossy bound documents that look great on a coffee table. What works for you and your organization is what you should use. Finally, and this is a point that few people get, including the experts that I've encountered and read, some strategic planning processes and the way to think about planning itself are better suited to some situations than others. A common complaint I hear is that the strategic plan just sits on the shelf, meaning that somehow it's not useful. There are several possible answers to this perceived problem. Of course, it could be that the process used was poorly executed and the resulting plan didn't meet the organization's need. It could also be, and I've frequently seen this, that the process was fine, agreement on the planning questions was reached, but the document itself was secondary. While it may sit on the shelf, the act of creating it and the shared organizational learning that occurred was what was important. Finally, and I think this is new, what we are coming to realize is that different approaches to strategic planning may be more appropriate in some situations than others. While a detailed discussion of why that is and what it means for planning is beyond the scope of this module, I will give you a taste of what I mean in the next section, and then give you a general, common model of strategic planning that you can use in many situations.